Good afternoon and welcome to the Assembly Committee on Commerce and Labor. Committee Secretary, will you please take roll?
Assembly members Anderson, Carter, present. Cole, Hardy, Hadigi, Kasama, Miller, Monroe Moreno, O'Neill, Roth, Torres Fawcett, Yeager, Urick, Chair Marzola.
And I am here. Please mark members present once they arrive. Welcome everyone that is here with us in Carson City, those of you in Las Vegas, and anyone tuning in over the internet. Today we will hear three bills: Senate Bill 246, Senate Bill 292, and Senate Bill 387. I will not be taking those in order. Before I get started, I would like to make some housekeeping announcements. Member of the public may provide testimony in various ways, which are all listed on the agenda. When testifying, please remember to turn on your microphone to speak and off to listen, and also remember to state and spell your name for the record. If you have handouts for the committee, please provide 20 copies to the committee secretary. Committee information is available on the legislature's website. You may also watch our meetings through the legislature's YouTube channel. We ask that public comment be kept to 2 minutes so that everyone can be accommodated. As always, I expect courtesy and respect in all our interactions, even if we may not agree. Finally, please make sure to put all your electronic devices either on off mode or silent mode, especially your cell phones. And with that, we will move to our first agenda item. I will now open the hearing on Senate Bill 387. This measure revises provisions relating to the prevention and early detection of lung cancer. Welcome, Senator Lang. You may begin when you're ready.
Thank you so much. And we have Dr. Mehta on Zoom. And thank you so much for taking these bills out of order. The doctor needs to get back to his patients, and so doing this bill first helps us out a lot. Good afternoon, Chair Mazzola, members of Commerce and Labor. I'm Roberta Lang. I represent Senate District 7 in Clark County. Today, I'm going to present Senate Bill 387, which is a critical piece of legislation to improve the prevention and early detection of lung cancer. With us on Zoom today is Dr. Mehta, who is the Director of Interventional Pulmonology at the Lung Center of Nevada and is also the Department Chair of Pulmonology at Mountain View Hospital, both in Las Vegas. Lung cancer remains a significant health concern in the United States, with an estimated 226,650 new cases expected in 2025, according to the American Cancer Society. It is the second most common cancer both in men and women, and tragically is a leading cause of cancer deaths. According to the Center for Disease and Control and Prevention, in short, the CDC, early detection of lung cancer is crucial for improving survival rates. When lung cancer is found at a localized early stage, before cancer cells spread within and around the lung and other parts of the body, treatment is more effective and there are more treatment options available. Research shows that patients with early-stage lung cancer have a high 5-year survival rate exceeding 75%, while survival rate for stage 4 lung cancer is less than 10% in the same span. This brings us up to Senate Bill 387. Requiring health insurers to cover lung cancer screenings improves early detection and treatment. Similar to prostate cancer or colon cancer, screenings we already require in statutes. Medicare, for instance, already covers annual lung cancer screening for qualifying high-risk individuals. At this point, I'd like to hand it over to Dr. Mehta for additional background information.
Thank you, Senator Lang. I appreciate the opportunity. I'd also like to thank Chair Marzola and members of the committee for this opportunity to speak today and for taking the bill out of order. I appreciate it. My name is Dr. Vishish Mehta. First name is Vishisht, last name Mehta, and I am the Director of Interventional Pulmonology at the Lung Center of Nevada Division of Comprehensive Cancer Centers, and also Chair of Pulmonology at Mountain View Hospital in Las Vegas. I strongly support this bill because it has the potential to save lives by increasing access to lung cancer screening. Lung cancer is the leading cause of cancer-related death in the US and Nevada for men and women. It is curable if caught early. The 2-year survival for stage 1A1, which is the earliest stage, is 97%. But for stage 4B, the latest stage, is 10%. Unfortunately, most cases are diagnosed too late and options are limited. The best tool we have in this regard is low-dose CT screening. It's been proven to reduce lung cancer-related mortality by up to 20% in high-risk patients. It helps us identify cancer early. The scan is quick, painless, requires no needles and no contrast dye. This bill will bring greater awareness to lung cancer, ensuring more patients and providers understand the importance of screening and improve access. As a physician, I see firsthand the devastating impact of late-stage lung cancer. I've also seen the power and benefits of early detection. Patients whose cancers are found early, treated effectively, and whose lives were saved because of access to screening. I urge your support, and I'm happy to answer questions based on my professional capacity related to the medicine and science of this process. Thank you.
Thank you, Chair. And with that, we will answer any questions you might have.
Are you able to go through the bill for us? Thank you.
So in the bill, let me just go back one page. We made an amendment in the Senate, so I'm going to go over that amendment. So I think you have the reprinted version, but I just want to be clear about the process that we went through in the Senate. We had a conceptual amendment. The amendment removed, sorry, I can't get it out, the new requirements concerning lung cancer screening. So we removed sections 1, 3, 4, 6, 8 through 11. Instead, it requires commercial health insurers with policies of health insurance or health plans provide coverage for lung cancer treatment and to also provide lung cancer screenings in accordance with the guidelines for such screenings published by the American Cancer Society. Other guidelines or reports concerning lung cancer screenings from nationally recognized professional organizations, which include current or prevailing supporting scientific data. This is consistent with the existing requirements in state law concerning colorectal and prostate cancer screenings. For example, Chapter 689B of the Nevada Revised Statutes. Section 5 refers to Section 4, which I propose to amend, and therefore Section 5 will have the same requirements as set forth in the conceptual amendment. Sections 2 through 10 authorize the Commissioner of Insurance to require certain policies issued by a domestic insurer for covered individuals in another state include the amended language coverage requirements and suspend or revoke the certificate of authority issued to a health maintenance organization or certain other insurers that fail to comply with these screening requirements. Further, the amendment deleted Section 13, which would have required the governor to annually proclaim Lung Cancer Awareness Month and a Lung Cancer Screening Day. And it replaced references to the United States Preventive Services Task Force in Section 17, and now requires the Department of Health and Human Services to conduct a study to determine if lung cancer screening criteria adopted by the American Cancer Society creates inequities in access to screening for lung cancer-based sex or gender identity or expression, and submit a report on its conclusions and any recommendations for expanded criteria to increase access to screening for lung cancer to the Joint Interim Standing Committee of Health and Human Services. And with that, we'll answer questions.
Thank you, and thank you for your presentation on a really important bill. My father died of lung cancer, and so to see what he went through and what happens, and it was not caught soon enough. So thank you. With that, I will go to committee members. Are there any questions? I don't see any. Yes. That's what happens when you have a very good piece of legislation. Thank you so much. And with that, we will move to testimony in support of Senate Bill 387. Is there anyone here in Carson City wishing to testify? Please remember to state and spell your name for the record. You may begin when you're ready.
Good afternoon, members of the committee. Chair Marzola, Sasha Sutcliffe-Stevenson, SASHA-SUTCLIFFE -STEPHENSON, here for the Nevada Oncology Society. Just want to say thank you to the sponsor, and we are fully supportive of this bill.
Good afternoon. My name is Dr. Harrigal, Harrigal. I'm a local radiologist who specializes in cancer imaging. I have lived and worked in Nevada for more than 10 years, and I am in support of this bill. In many people, we find lung cancer when it's very advanced at a very late stage, after it's already spread to the brain, to the bones, to the abdomen. But fortunately, lung cancer screening is a tool that has been found to save lives through earlier detection, giving people a better chance to survive. One of the barriers that many people face in getting this test is that their insurance companies don't cover it, or they require high copays. Medicare already covers this test without a copay, and these insurance companies should do the same. Early detection saves lives from cancer. You have the ability to save many lives from cancer by passing this bill, SB 387. You would also be helping thousands of families in Nevada by reducing the financial burden that comes with lung cancer screening, a test that insurance companies should already be covering. Thank you so much for your time.
Good afternoon, Chair Marzola and members of this committee. For the record, my name is Carrie Harrington. I'm the Executive Director with Nevada Cancer Coalition. We're your nonprofit partnership of both private and public healthcare providers across the state. We're working together to reduce the burden of cancer. And as you can imagine, reducing the burden of late-stage lung cancer is a top priority for us. Huge thank you to Senator Lang for bringing this bill forward and her steadfast dedication to ensuring access to cancer screenings for all Nevadans. We concur with everything shared so far, and we support strongly SB 387. Thank you.
Good afternoon, Chair Marzola, Vice Chair Hattigi, and members of the Assembly Commerce and Labor Committee. I'm Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. Those 55 to 80 with a history of smoking or other risk factors are at a higher risk to develop lung cancer. Lung cancer is usually discovered in later stages because symptoms do not present in earlier stages. Early detection through screening offers more options for medical intervention and significantly increases chances of successful treatment. Therefore, our physician members are in strong support of SB 387. Thank you.
Good afternoon. My name is Annie Millard, ANNIE MILLARD. I am here representing Nevada Cancer Coalition. I'm a board member. I am also a retired nurse and 12 years in oncology. I have seen so many devastating deaths from lung cancer that was caught too late, and so many successes from seeing lung cancer that was caught early, and many survived that 5 years that was presented earlier. And I just encourage you to please pass this bill, which will save lives. Thank you.
Thank you for your testimony. Is there anyone else in Carson City wishing to testify in support? I don't see anyone. I see you seated in Las Vegas. You may begin when you're ready.
Good afternoon, Chair Marzola and members of the committee. My name is Jennifer Atlas, ATLAS, and I'm with the American Cancer Society Cancer Action Network. ACS CAN is the nonpartisan, nonprofit advocacy affiliate of the American Cancer Society. We advocate for evidence-based public policies to reduce the cancer burden for everyone. ACS CAN advocates for all insurance plans to provide a comprehensive benefit for lung cancer screening, including all follow-up testing according to recommended guidelines without cost sharing or other barriers. And we would like to thank the sponsor for adopting ACS guidelines.
Thank you for your testimony. I don't see anyone else in Las Vegas broadcast. Is there anyone on the line wishing to testify in support?
To testify in support for Senate Bill 387, please press *9 or raise your hand in the Zoom window to take your place in the queue. Again, if you wish to testify in support, please press *9 or raise your hand in the Zoom window.
Madam Chair, members of the committee, my name is Joanna Struther, and I am the Senior Director of Advocacy for the American Lung Association. The American Lung Association supports Senate Bill 387. This bill aims to reduce barriers to lung cancer screening and diagnosis and addresses potential inequities in access. This bill would add lung cancer screening to low-dose CT to Nevada statute to align lung cancer screening coverage with coverage for other screenable cancers. Cancer continues to be a significant burden on the people in our state and across the U.S. About every 2 minutes, someone in the U.S. is diagnosed with lung cancer, and every day lung cancer takes the lives of more than 361 people. Lung cancer is the leading cause of cancer deaths here in Nevada and across the U.S. Detecting lung cancer in early stages versus late stage is often the difference between life and death. Screening for lung cancer with low-dose CT scans among those at high risk can reduce lung cancer death rate by up to 20% by detecting tumors at an earlier stage when they are more likely to be curable. Currently, screening rates are very low among those at high risk. If lung cancer is found before it spreads, the likelihood of surviving 5 years or more improves to nearly 64%. With that, we would like to thank the sponsor and thank you, Chair and Committee, for hearing this bill. Thank you.
Chair, the public lines are open and working, but we have no more callers for support at this time.
Thank you. We will move to testimony in opposition of Senate Bill 387. Is there anyone here in Carson City wishing to testify in opposition? I don't see anyone. I don't see anyone in Las Vegas broadcast. Is there anyone on the line?
To testify in opposition to Senate Bill 387, please press *9 or raise your hand in the Zoom window to take your place in the queue. Chair, we have no callers for opposition at this time.
Thank you. We will move to neutral testimony. Is there anyone in Carson City wishing to testify in neutral? And just like that, you're back. You may begin when you're ready.
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance. I have to say, I was telling staff before the meeting that you may be cursed. I believe there are more insurance bills on the Senate side than there were on the Assembly, so you may be seeing more of me than you wish to. The Division of Insurance is neutral on Senate Bill 387. We evaluate the mandate as providing the same sorts of benefits as the U.S. Preventive Services Task Force Grade B recommendation for lung cancer screening, meaning that Senate Bill 387 would not trigger federal defrayal provisions as currently constituted. I did provide some written testimony. I did also note that that evaluation is contingent upon potentially the outcome of the federal court case, Braidwood Management Incorporated et al. V. Robert F. Kennedy Jr. et al., formerly docketed as Braidwood v. Becerra. That court case actually was heard on Monday before the U.S. Supreme Court. So if you're the type who likes to look at professional or amateur Supreme Court blogs and figure out what's going on. You may do so and figure out where that court case may be headed. But the gist of it is, should the plaintiffs in Braidwood prevail and the U.S. Preventive Services Task Force provisions be struck down as unconstitutional, then Senate Bill 387 would likely be determined to be a mandate in excess of essential health benefits and trigger defrayal. But if the defendants are successful, then the U.S. Preventive Services Task Force recommendation stays in place and it would not trigger defrayal. I would be happy to answer any questions that committee may have.
Committee members, any questions? I don't think so, but I appreciate the update. Thank you so much. Is there anyone else in Carson City wishing to testify in neutral? I don't see anyone. I still don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
To testify in neutral to Senate Bill 387, please press star 9 or raise your hand in the Zoom window to take your place in the queue. Chair, we have no callers for neutral.
Thank you. Senator Lang, would you like to give any closing remarks? I will now close the hearing on Senate Bill 387. I will now open the hearing on Senate Bill 246. This measure revises provisions relating to health insurance, coverage for gynecological or obstetrical services.
I know it's a mouthful, right? Good afternoon. I'm still Roberta Lang, and I represent Senate District 7 in Clark County. I have the honor today to present Senate Bill 246. This legislation increases access to gynecological and obstetrical services for women, removing unnecessary barriers set forth by their health insurance plans. I'll give you a little bit of background information. While prior authorization aims to reduce unnecessary care, it may limit or delay medically necessary care. Health insurance routinely use prior authorization or referrals, which can create significant barriers to timely care. This is particularly concerning in fields such as gynecological oncology, where delays can impact survival rates. Studies show prior auth can result in an average delay of 2 weeks for cancer care, with over 1/4 of patients experiencing such delays during the treatment. In another large cohort study on the use of prior auth in gynecological oncology care, researchers found insurance and racial disparities occurred in prior auth. Specifically, the findings show female patients with Medicare Advantage plans had a 76% increased risk of experiencing prior authorization, and female patients of Asian descent had a 60% increased risk. Further, prior authorization process can be opaque and unpredictable, complicating decision-making for both patients and physicians. Senate Bill 246 seeks to address these issues by expanding the requirements for direct access to gynecological and obstetrical services. Chair Mazzola, with your permission, I'll briefly go through the bill. Thank you. In Nevada, we have statutes requiring certain public and private health insurers to directly authorize gynecological or obstetrical services with prior authorization or referral from a primary care physician. Sections 1 through 6, 8, and 9 additionally apply these requirements to health plans that provide medical care to certain private sector employees of small employers and their dependents. Benefit contracts issued by fraternal benefit societies, managed care organizations, the Public Employees Benefit Program, and Nevada Medicaid. Section 7 makes conforming change, and Section 10 makes the bill effective on January 1, 2026. By eliminating the need for prior authorization or referrals for these critical services, we can improve health care outcomes and reduce disparities in care. Therefore, Senate Bill 246 is an important step toward expanding access to timely and equitable care for all women in our state. And I just might add, if you have a PPO insurance plan, you don't have to get a referral from your primary care doctor to go to a gynecologist. But if you have an HMO, and those insurance policies are generally for people that can't afford a PPO, you have to go to your primary care doctor to get a referral to go to a gynecologist, therefore costing you more money up front. And this bill would make that go away, so no one needs a referral. You can go straight to the gynecologist. And so this completes my presentation, and I'm happy to answer any questions.
Thank you, Senator, and thank you again for bringing a really good bill. And you actually answered my question as far as the PPO and HMO and how that would work, so thank you for that. Committee members, any questions? Assembly Member Kasama.
How about that? Oh, there we go. Backup plan. Thank you all for helping me figure that simple thing out. So, great plans, and I like this. This is also good, everything that you're bringing. My question was, I noticed in the Senate hearing that there was concern that a woman cannot designate their OB/GYN as a primary care physician, and it looked like there was maybe some talk about fixing that, and I see it's still in Section 2, subsection 2. I was just wondering if you had found out that you couldn't do that, or what you could share on that.
Thank you for that question, Senator Lang, for the record. So that was a question, and I should have brought that up. There are women that want their gynecologist to be their primary care doctor. I've talked to some stakeholder groups, and they'd like that to be changed. I've discussed it with the Senate caucus, and frankly, I don't have the votes to be able to change the language, because people think it's bad policy, that you should keep your primary care doctor to deal with primary care situations. But I would love, Chair Marzola, if you could ask your attorney, because what I was concerned about is that, does the Affordable Care Act say that it would be okay? Because I've heard conflicting messages that it could be a primary care or it can't be a primary. I just don't know.
Thank you, Madam Chair. Sam Quast, Committee Counsel. I don't know the answer to that. What I do know is that the provisions in this bill that prohibit that are consistent with the provisions in existing law where this already exists that says that you can't designate them as a primary care physician. But I don't know the implications of the Affordable Care Act. I can look into that and get back to you.
Thank you, Mr. Quest. We'll look into it, and then I'll provide all the information to you, Senator, and also the committee members. Assemblymember Cole.
Thank you, Senator, for the presentation and bringing this bill. So my question is, you had mentioned the HMOs and the PPO difference, right? And I'm sure you know this, right? But the cost for premiums on PPO is much higher than anything on HMOs. And I don't know how much of that is attributed to the fact that you don't have to go through and get the referrals and everything else. But is there any concern that there will be an increase in premiums for those on HMOs to deal with this? Thank you.
Roberta Lang for the record. Assembly member, thank you for that question. I have talked to the insurance companies. No one has mentioned that there would be a price increase for this. So I can't really answer that question any further. And maybe during testimony, one of them will be able to answer that. Thank you.
Thank you. Assemblymember, you may want to take that question offline to some of the different stakeholders. Assemblymember Torres Fawcett.
Thank you. I really appreciate this legislation because I know just to get an appointment with an OB in Southern Nevada can be more than 6 months. I had an appointment that had to be canceled in September, and I wasn't able to reschedule it until January, and then I had budget briefings, so I wasn't able to reschedule it till June. And unfortunately, that's something that happens far too often. So I'm just wondering if you could talk a little bit about some of the benefits to patients and being able to immediately be able to see their OB. I mean, there can be a number of reasons why a patient might need to see an OB. So if you could talk about why they might need to see an OB instead of just their primary care physician.
Thank you, Senator Lang, for the record. So I think that there are a number of things. I mean, and I thank you for that question because I'm mortified that it would take you that long to see your OBGYN when women have pressing issues that they need to have taken care of. And then when you have to wait that long, it could be a domino effect in your health care. And so I think that, women go to gynecologists because they're having babies, because they have infections or something going on in their women parts of their body. And so it's important that we have access, and we know that the time to get into your primary care doctor is a really long time. So being able to go straight to your gynecologist to deal with it and not have to pay that additional copay, I think is really important because they're the people that can least afford it.
Thank you. Just a quick follow-up, Chair. Do you have any information about how long it generally takes to get an appointment with our primary and our OBs? And maybe somebody else in this room would be able to help answer that because I know to get into my primary it's at least 6 weeks. So I'm just wondering then what the timeline looks like for a patient that's trying to get this care.
Roberta Lang for the record. I'm not sure how long it would take to get this care because, as you know, in Nevada, we have physician shortages in all areas. And so it just gives another opportunity. I mean, it doesn't say you can't go to your primary care doctor. It just says that if you feel like you need to go to your OBGYN, you can go without getting a referral.
Committee members, any additional questions? I don't see any. We will move to testimony in support of Senate Bill 246. Is there anyone in Carson City wishing to testify in support?
Hello, Chair Marzola, members of the committee. I'm sorry, I was texting my doctors, furiously asking about what the turnaround time is. Hopefully they'll answer me, but I'm sure they're in with patients. I'm Jacqueline Wynn, NGUYEN, representing the Nevada State Medical Association. Prior authorization reform is a top priority for all Nevada physicians and is our advocacy priority this session on behalf of patients, physicians, and other providers of health care. Particularly with SB 246, OBGYN services should be provided for all patients in a standard care that should not require prior authorization or referral, as it is essential healthcare services for women. And with essential medical services, requiring prior authorization can create delay and unnecessary administrative burdens, which delay care and add costs to not only physician practices, but also, and most importantly, to patients. I really appreciate the question, Assemblymember Kasama. We know that in the prior hearings, there was discussion about opening the statutes and proposing language that would allow for one to designate an OBGYN as a primary care physician. In speaking to our OBGYN members and our primary care members, we would be in full support of that amendment. So thank you so much.
Thank you. Is there anyone else in Carson City wishing to testify in support? I don't see anyone walking up. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
To testify in support for Senate Bill 246, please press *9 or raise your hand in the Zoom window to take your place in the queue. Chair, we have no callers for support at this time.
Thank you. We will move to testimony in opposition. Is there anyone in Carson City wishing to testify in opposition? You may begin when you're ready.
Good afternoon, Chair Marzola and Committee. Shelley Capurro representing the Nevada Association of Health Plans. And I actually signed in neutral because I was going to clarify, as I did on the Senate side, that we just wanted to clarify that this bill, the intent was to not have a member be required to go to their primary care in order to go to their OBGYN. We are neutral on that. But in this presentation, it started to look more like a prior authorization bill. So that's why I'm in opposition. So we're just going to have further conversations with the sponsor, which she's amazing in having conversations with us, and then we will figure out where we're at on this. Okay, thank you.
Is there anyone else in Carson City wishing to testify in opposition? I don't see anyone in Las Vegas broadcast. Is there anyone on the line?
To testify in opposition to Senate Bill 246, please press star 9 or raise your hand in the Zoom window to take your place in the queue. Chair, we have no callers for opposition at this time.
Thank you. We will move to neutral testimony. Is there anyone in Carson City wishing to testify in neutral?
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance. We submitted written testimony talking about defrayal. This is not a defrayal item to our understanding. I wanted to use my time, though, to talk about some of the questions. To clarify, under the Affordable Care Act, plans subject to those provisions must allow an OBGYN to be designated as a woman's primary care physician. Additionally, health plans, regardless of whether it's a PPO, HMO, point of service, EPO, doesn't matter, they are not allowed to require prior authorization before a woman sees their OBGYN, regardless of whether they are the primary care physician or not. I'd be happy to work with committee staff to get those citations. I don't have them handy right now, but we can work through that. It is an essential health benefit under the primary care EHB, so that's why it trickles through that way. I will say, if you reference the handy market guide that the division published at the beginning of the session, on page 20, there's a nice pie chart that we produced talking about the premiums by line of business. When the market that we regulate, the fully insured marketplace, the ones that we can say are subject to ACA provisions in this matter are the large group, individual, and small group market. That is 18.5% of Nevada's population, right? So 81.5% of Nevada's population are not subject to Division of Insurance regulation, potentially not subject to these provisions of the Affordable Care Act because they are ERISA self-funded plans, on Medicaid, Taft-Hartley plans, uninsured. So existing provisions do not apply to them, and potentially the provisions of the bill wouldn't apply to them either because the state can't regulate ERISA plans and whatnot. So I wanted to put that on the record to clarify. Happy to answer any questions.
Thank you. Can you provide us the citations to the committee secretary so that I can provide it to all the committee members?
Adam Plain, for the record, certainly. Off the top of my head, it's something like 45 CFR 145.104. Don't hold me to that because the federal regulations bump around between 45 and 42 as the chapter, and I can't keep them straight. But it's in that general area code.
Okay, we will wait for your email. Thank you. Is there anyone else in Carson City wishing to testify in neutral? I don't see anyone. I don't see anyone in Las Vegas broadcast. Is there anyone on the line?
To testify in neutral to Senate Bill 246, please press star 9 or raise your hand in the Zoom window to take your place in the queue. Chair, we have no callers for neutral.
Thank you. Senator, would you like to give any closing remarks?
Senator Lang for the record. So I think that's good news. And I look forward to updating the bill with an amendment and getting it back to the committee. Thank you.
Thank you. I will now close the hearing on Senate Bill 246. I will now open the hearing on Senate Bill 292. This measure revises provisions relating to Medicare supplemental policies. Welcome back, Senator.
Thank you so much. I feel like it's my special day. Good afternoon again. I am Roberta Lang, representing Senate District 7 in Clark County. I have the honor to present Senate Bill 292 today. This legislation increases access to Medicare supplemental health insurance policies for Medicare beneficiaries under the age of 65. Before I begin my presentation, I just want to, I don't often share personal stuff, but I am a kidney patient. I'm in stage 5 renal failure. I'm getting a transplant in the fall. Lucky for me, I'm over 65, and so I have the benefit of Medicare and a Medigap policy that will cover the entire transplant. Today, I'm going to talk to you about patients that are under 65 that are granted Medicare coverage, but they don't have a Medigap policy to cover the additional amount, which makes having a transplant unaffordable. And for them, it's life or death. And so I want to talk to you about what other states are doing and how I think we can help the 1,000 patients in Nevada that need this coverage. So with that, most of you know Medicare is a federal health insurance program for seniors who are 65 years of age or older. A less known fact is that millions of individuals younger than 65 years can also enroll in Medicare because they suffer from end-stage renal disease, also called ESRD, or certain qualifying disabilities. You may also know that seniors enrolled in Medicare choose to sign up for a Medicare supplemental policy, also called Medigap insurance, because it covers payments for coinsurance and copays, as well as certain deductibles and adds certain health benefits. However, federal law does not require insurers to offer Medigap policies to Medicare beneficiaries under the age of 65, leaving a substantial portion of the Medicare population vulnerable to high out-of-pocket medical costs. Research has consistently shown that younger Medicare beneficiaries face unique challenges. They are more likely to have low incomes, poor health, and severe chronic conditions. They also experience higher rates of access and affordability issues compared to older beneficiaries. A Kaiser Family Foundation study found that beneficiaries under 65 with disabilities reported worse access to care, more cost concerns, and lower satisfaction than with the care that seniors receive. Currently, 36 states require Medigap insurers to issue at least one kind of Medigap policies to beneficiaries under the age of 65, typically through an individual open enrollment period. Unfortunately, Nevada is not part of those 36 states. The lack of access to Medigap policies can have severe financial consequences. For instance, this financial burden can potentially jeopardize a Medicare beneficiary's chance to get a kidney on the kidney transplant list, which, as you know, as I shared, is very personal to me. For these reasons and others, the American Kidney Foundation, an advocacy organization for people suffering from end-stage kidney disease, urges states to pass legislation that would require insurance companies that offer Medigap coverage to make it available to Medicare beneficiaries under the age of 65 that offers the same premiums, conditions, and services to those beneficiaries over 65 years of age. Senate Bill 292 is aiming to fix this issue. With your permission, Chair, I will briefly summarize the key provisions of the bill. Thank you. Section 2 establishes the applicability of the definition Medicare supplemental policy. In Section 3, Section 4 is the key section of the bill that I'll briefly summarize its subsections. Subsection 1 requires a health insurance offering a Medicare supplemental policy to allow eligible individuals less than 65 years of age who are enrolled in Medicare due to a disability or end-stage renal disease to purchase any Medicare supplemental policy that an insurer offers to new insurers who are 65 years of age or older. Section 2 prohibits such insurers from imposing any limitation, term, or condition relating to coverage, benefits, protections, policies, or procedures with respect to Medicare supplemental policy issued to an individual under 65 years of age, unless they are also applied to an insured who is 65 years of age or older. Subsection 3 requires insurers to offer a supplemental policy to the same premium rates to an eligible individual as they would charge individuals who is exactly 65 years of age for such policies. Subsection 4 sets forth an insurer must establish an open enrollment period to purchase Medicare supplemental policies during a 6-month period commencing the first day of the first month, which individuals less than 65 years of age are enrolled in Medicare Part B coverage. And lastly, subsection 5 prohibits an insurer from taking certain actions during the open enrollment period set forth in subsection 4, including but not limited to imposing an exclusion of benefits during that open enrollment period based on pre-existing medical conditions. Section 5 and 6 make certain conforming changes, and Sections 7 through 9 apply to the provisions of Section 4 to a hospital or medical services corporation and state and local governments that offer insurance to employees. Regarding the effective date, Section 10 requires insurance to establish an open enrollment period for individuals who become eligible for Medicare supplemental policies if this bill passes. The period commences on October 1, 2025, and remains open through April 1, 2026. And with me today, I have Pamela Zielinski, Western Regional Advocacy Director for Dialysis Patient Centers, and she will give a little more in-depth information about the cost and how this works.
Thank you, Senator Lang. Good afternoon, Chair Marzella and members of the committee. My name is Pamela Zilski, Z-I-E-L-S-K-E, and I'm the Western Region Advocacy Director for Dialysis Patient Citizens. We're the largest nonprofit patient advocacy organization in the country that works on behalf of end-stage renal disease patients. I'm here testifying in support of Senate Bill 292 and want to thank Senator Lang for introducing this important bill. As Senator Lang mentioned, 36 states require insurers to sell at least one Medigap plan to eligible individuals who are under the age of 65. 17 of these states have already passed laws like SB 292 that provide premium protections to ensure these plans are affordable for patients. By doing so, these states are making sure the playing field is even and that people are not penalized for getting sick while they're young. Nevada's neighbors, Oregon and Idaho, are among those states that already have affordable Medigap laws on the books, and we're seeing more and more states passing laws each year. Indiana just passed affordable Medigap for the under 65 population last year, and the states of Kentucky and Virginia passed Medigap legislation in 2023. SB 292 uses the proven same as age 65 premium protection formula that has been used in the state of Kansas since 1999. This is a well-tested model and it works. In fact, this year, Kansas has 43 different insurers selling Medigap plans to the under 65 market, and the average monthly premium there, regardless of age, is $218 a month. It's also worth noting that Kansas has a roughly similar population size as the state of Nevada. Right now, a 65-year-old Nevadan has access to all 10 lettered Medigap plans, plans A through N. But if a person is diagnosed with ESRD when they're younger than age 65, they can't purchase a Medigap policy in the state of Nevada because they simply aren't available. This explains why so many dialysis patients spend down their assets into poverty so that they can become eligible for Medicaid. In addition to providing patients with financial security, this bill also provides a pathway to a life-saving kidney transplant, as Senator Lang mentioned. Most transplant centers require supplemental insurance coverage or adequate savings to ensure that a patient can keep their new kidney healthy post-transplant. I do want to mention that a kidney transplant can extend adult life expectancy by 8 to 12 years, and even longer with a living donor transplant. Access to a transplant also means that people can lead the life they want to lead without dialysis, and in many cases, it means they can return to work. Before I close, I'd like to mention a few things about cost. The report from Health Management Associates, or HMA, which is a part of the record, explored this issue of cost. HMA, which is a well-respected independent actuarial firm, evaluated Medicare fee-for-service claims data and determined if Medigap carriers in Nevada were required to offer policies to those under 65 with ESRD and set premiums at the same rate a 65-year-old patient is paying, it would result in an increase for the overall pool of 0.9%, or about $2 per month. This is because the pool of individuals who was purchasing Medigap plans as a result of the bill would be very small. There are only about 1,500 ESRD patients in the state of Nevada who are under age 65, and of this group, 991 of them are considered non-duals. They're on Medicare, but they're not eligible for Medicaid. There are over 140,000 Nevadans who have Medigap plans. So if SB 292 passed, absorbing some of these 991 ESRD patients who are not eligible for Medicaid would represent a de minimis amount of the overall pool. The bill can also help prevent cost shifting to the Medicaid program by preventing more patients from spending down their hard-earned assets to qualify for Medicaid. You'll notice in the HMA report, it also estimated that as many as 1 in 4 non-dual Nevadans could annually avoid spending down their assets that lead to Medicaid eligibility, and estimated a savings to the state of Nevada of roughly $900,000 over a 5-year period. The impact of this bill would be both life-changing and life-saving for Nevadans with ESRD who are under 65, and I urge your support of the bill. I'd like to also invite Mr. Charles Leiser to share his story as a Nevada resident. Thank you.
Hi, my name is Charles Leiser, CHARLSELIZER. I'm a kidney patient. I've been on dialysis for almost 10 years, and I've been on the list for kidney transplant in Utah and now in Nevada for quite a while. But in order for me to actually get a kidney transplant, I'm going to have to come up with the 20% up front, which I'm being told is anywhere from $20,000 to $40,000. And I have been saving, and I've got some money saved up, but nowhere close to that amount. I work full-time currently, so I don't qualify for Medicaid. And I'm supporting this bill and would like, because this bill would help me tremendously, because it would take a lot of the burden of that $40,000 I have to save off my shoulders. And it would improve my quality of life because instead of being stuck on a machine 4 hours a day, 4 days a week, I could travel, I could do stuff, I could spend more time with my family, I could go places that I currently can't do right now because I have to be tied to my machine every day. I guess that's about it. Thanks for letting me speak.
Thank you, Chair, and that concludes our presentation. We'd be happy to answer any questions.
Thank you for your presentation. Thank you both for sharing. I think it gives a whole entire different perspective when you have real life stories. So I know it's tough, but thank you for being great advocates. And with that, committee members, are there any questions? Assemblymember Yurick.
Thank you, Chair, and thank you so much for the presentation. I'm really sorry to hear about your story, but I appreciate you sharing it. I have a personal friend who is in stage renal failure, and what a tough process that is. So I definitely see the importance of this bill, really like it, and I've heard a lot of references to the end-stage renal failure and its impact and costs that are going to now or that we're going to incur. And perhaps as I was reading and looking at it, I may have missed it, but as I understand in Section 4, it also makes reference to folks that are eligible for and enrolled in Medicare on the basis of disability. Is that a separate group of folks that would be eligible? No, that is directly tied to the end-stage renal? Okay, thank you.
Any additional questions, committee members? Assemblymember Cole.
Thank you for the presentation. My sister actually is the recipient of a kidney transplant from last year, and so I definitely feel the concerns and understand the issues. And I've actually been she has Medigap, and she's in Pennsylvania, but I've also helped cover a lot of the costs that were not borne by those policies. So my question is specifically on, you had mentioned that 36 states had at least one kind of Medigap, and there's A through N, so there's a lot of options out there. Your language says any Medicare supplemental policy. So was there a distinct reason why you said any, and it can't just be one or two options for people, or can you just speak to that? Thank you.
Senator Lang, for the record. If we just did one Medigap policy, it would still mean that the patient would have to pay a lot out of pocket. And having multiple Medigap policies available where a patient could sign up for any of those, it kind of spreads it out. And I don't know if Pamela might want to add a little bit more information, but I think it was more equitable doing it this way.
Pamela Zilski for the record. Yes, Senator Lang is correct. I believe 25 of those 36 states actually require all 10 of those plans to be available. There are a few states that I know of, 3 that come to mind that essentially say that three plans have to be available, and then, have different types of formulas for the others. A lot of it comes down to each of those 10 lettered plans cover different things. And so by allowing patients to choose, they can make a decision about which plan is going to best meet their medical needs.
So the more plans available, the better options for the patients, essentially. Committee members, any additional questions? I don't see any. So I'll give you a couple of seconds. And we will start with support testimony of Senate Bill 292. Is there anyone in Carson City? You may begin when you're ready.
Good afternoon, Madam Chair. Dan Musgrove with Strategies 360 today on behalf of Nevada Donor Network. Our mission is to save and heal lives through organ, eye, and tissue donation. And we're part of that story that you heard today, and we think that there's probably anywhere between 700 and 2,100 Nevadans that are going to need a kidney transplant. because of the very reasons you heard today, a lot of that goes unreported because they don't have the ability to access the medical care that they need. And here's another perspective, that kidney failure has a disproportionate impact on people of color. Compared to white Americans, the likelihood of developing kidney failure is 4.3 times greater for Black Americans, 2.3 times greater for American Indians, 1.6 times greater for Asian Americans, and 2.2 times greater for people of Hispanic or Latino ethnicity. The very reason we need these coverages is to help those people access the medical care that they need. As you heard, the gentleman who spoke very, eloquently about his own personal circumstance, how do we all usually buy a car? We buy it on payments, right? We can't come up with the down, we can't come up with the big lump sum. Medigap Insurance allows them to pay as you go to get an insurance policy that's going to cover that big gap. So we ask for your support, and thank you.
Good afternoon. I'm so sorry that you're seeing me so much today, but I did want to be 3 for 3 in support for Senator Lang Day in committee. I'm Jacqueline Nguyen, Nguyen, still with the Nevada State Medical Association. We'd like to thank Senator Lang for bringing forth this bill on behalf of patients. I had shared before that I'd seen firsthand the medical difficulties and financial hardships patients face when I helped my own niece, Brittany, through the long process of receiving her own kidney transplant just a few years ago. She's now thriving, but the cost of her care was a constant worry for my family. Medicare supplemental insurance is sometimes a crucial resource for patients that can provide significant financial protections and access to care. Therefore, our physician members are in full support of SB 292. Thank you.
Thank you, Madam Chair and members of the committee. For the record, my name is Paige Barnes with the Ferrado Company. Here today on behalf of Fresenius Medical Care. We are a kidney health company providing dialysis along with other care in the state to Nevadans. We are here in strong support of SB 292. We really appreciate Senator Lang for sponsoring this bill and for everyone sharing their personal stories. We have submitted a letter of support for the record and urge you to review that. Thank you.
Hello, Chairman Marzola, members of the committee. Dean Marcoccia, M-A-R-C-O-C-C-I-A, very long name. With Biogen, we are a company focused in research and development in end-stage renal disease. We commend Senator Lang. This is your day today, and we strongly support this bill. Thank you.
Good afternoon, Chair Marzolo, members of the committee. For the record, my name is Jimmy Lau, first name J-I-M-M-Y, last name L-A-U, with Ferrari Reader Public Affairs representing DaVita, also a dialysis company provider, here in strong support of the best interests of our patients and this bill. And we'd like to thank Senator Lang for her leadership on this issue and everyone who shared their personal stories as well. Thank you.
Hi, my name is Ernesto Molmenti, spelled M-O-L-M-E-N-T-I. I'm a transplant surgeon. I came here to Nevada to change the life of those in need. And I'm delighted to support Senator Lang's bill. Also in support of all those who are in severe need. People with kidney failure are not only medically disadvantaged, but in most cases, financially and socially disadvantaged. To have access to a transplant, in addition to the financial resources, it requires for them to have social resources to help them recover from the surgery, to have financial resources to travel, to bring their caregivers with them. These are individuals who, the mortality rate on dialysis is 60% at 5 years. After 5 years, half of those individuals on dialysis will be dead. And I think it's a responsibility to act on behalf of them, to give them a chance, irrespective of their age. Kidney failure is not something that we induce on ourselves. It's something that comes along the way through many illnesses, both congenital and acquired. So I think that all these individuals who are disadvantaged, who are dying while going on dialysis, deserve a chance to be able to benefit from what we provide. Kidney transplantation provides 3 main benefits. One is improved survival. We live longer. One is a better quality of life. When we have, for example, a 3-day weekend, individuals on dialysis cannot say, I'm going to go for a trip wherever I wish. When they're more than 2 days out of where the usual location is, they need to arrange for dialysis centers to be able to dialyze them. Otherwise, they would die, usually due to high potassium. And from a public health perspective, transplantation is cheaper than dialysis. So we have to keep all those things in mind when we make a decision. That's in a brief summary what I think. Are there any questions? And Assemblyman Urek, I hope your friend comes to see me so I can transplant him or her.
Sir, if you can please
Yeah.
wrap up your testimony.
Perfect.
Thank you.
Thank you. Bye-bye. Great to see all of you.
Is there anyone else in Carson City wishing to testify in support? I don't see anyone. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
To testify in support for Senate Bill 292, please press star 9 to take your place in the queue. Caller with the last 3 digits, 797, please press star 6 to unmute yourself.
Hi, my name is Diana Arevalo, Arevalo, and I have the privilege of serving as the Managing Director of Advocacy at the ALS Association. Today, I speak before you on behalf of the brave individuals and families in Nevada who are facing the unimaginable reality of living with ALS. I speak before you with a simple and urgent request. Please support SB 292. ALS, amyotrophic lateral sclerosis, is a devastating disease. It takes away a person's ability to walk, talk, eat, and breathe, and yet there is no cure. For those living with ALS, every single day is a battle, not just against the disease itself, but against the overwhelming financial and logistical burdens that comes with it. The cost of care can exceed $250,000 per year, forcing families to make heartbreaking decisions, draining retirement savings, taking on debt, and worrying about how to protect their children's futures. One of the most pressing concerns for these families is health insurance. This bill offers a vital solution by ensuring that people under the age of 65 who are living with ALS can access affordable Medigap coverage. This would help close a dangerous gap in healthcare, giving patients and their loved ones peace of mind during an unbearable time. Most people with ALS qualify for Medicare as soon as their Social Security disability benefits begin. But Medicare alone isn't enough. It covers only 80% of medical expenses with no cap on out-of-pocket expenses. For many, this means thousands of dollars in expenses just to access essential care. Medigap coverage could be the difference between affording life-sustaining care or going without. Expanding Medigap coverage is more than just a policy change, it's a lifeline. For all these reasons, I urge you to support SB 292.
Good afternoon, Madam Chair and members of the committee. My name is Josie Gamez, Josiegamez, and I'm the Associate Director of State Policy and Advocacy for the American Kidney Fund. And I'm here today to testify in support of Senate Bill 292, which seeks to expand access to Medigap coverage for kidney patients, providing them a better opportunity to live a healthier, longer life. Medigap coverage is especially critical for kidney patients in Nevada because Medicare only covers 80% of their medical expenses, leaving many patients with significant out-of-pocket costs for life-sustaining care. Additionally, having secondary insurance coverage, such as Medigap, is a key requirement in the transplant evaluation process. And due to the scarcity of available organs, transplant centers require patients to demonstrate they have adequate insurance to cover their ongoing medical costs necessary in order for them to maintain a transplanted organ. So without Medigap, many kidney patients face a major barrier to receiving a life-saving transplant simply because they lack sufficient coverage. By expanding access to Medigap, Senate Bill 292 would help ensure that the kidney patients can afford the care they need, improve their chances of receiving a transplant, and ultimately enhance their overall health and quality of life. Thank you for the opportunity to testify and for your time and consideration.
Good afternoon, Chair Marzola and committee members. My name is Jim DeGraffenreid, JIMDEGRAFFENREID, and I'm an independent insurance broker in Minden, Nevada, testifying today in support of SB 292 in that capacity. I've been an insurance broker in Nevada for almost 25 years. I'm licensed in Nevada, California, Oregon, and Texas. Over the years, I've had many clients fall into this situation where they're forced into Medicare. There's been a focus on end-stage renal disease today, but Section 4 of the bill also covers those under 65 who are on disability and forced onto Medicare after 24 months. Unfortunately, they're not able to purchase a Medigap policy until they turn 65. As Senator Lang pointed out earlier, this leaves these beneficiaries uncovered for significant out-of-pocket costs. In many cases, Medicare without a supplement is worse coverage than the insurance they had before the disability, but federal law forces them into Medicare. It is possible for these individuals to sign up for a Medicare Advantage plan, but these can be difficult to navigate due to limited networks and other restrictions. SB 292 fills the gap by allowing these beneficiaries to buy a full-service plan that will cover their medical needs without network limitations. This is a bipartisan issue, which is why all 20 senators present voted in favor of the bill earlier this month. I thank Senator Lang for bringing this bill forward, and we urge this committee to support this bill to help Nevada citizens who have been forced onto Medicare before age 65. Thank you.
Chair, the public lines are open and working, but we have no more callers for support.
Thank you. We will move to testimony in opposition of Senate Bill 292. Is there anyone in Carson City? Please remember to state and spell your name.
Good afternoon, Madam Chair, members of the committee. Good to see each of you. For the record, Trey Abney, T-R-A-Y-A-B-N-E-Y, here today representing America's Health Insurance Plans, also known as AHIP. We appreciate Senator Lang bringing forth this issue. Our concern centers around cost, and that the under 65 population is also eligible for Medicare Advantage, which is heavily subsidized by the federal government. Should Nevada require coverage of ESRD for the under 65 population, we are concerned that they represent a very expensive portion of the population that would be added to this risk pool. On average, ESRD beneficiaries incur spending that is about 6 times greater than spending for beneficiaries ages 65 years and older without ESRD. Requiring carriers to include under 65 patients in the Medigap risk pool and restricting premium rates for these individuals to the lowest possible rate, as this bill calls for, will result in increased premiums for the seniors for whom these policies were created. Many Medigap enrollees are lower income and live in rural areas. Shifting the expense of the under 65 population onto seniors with Medigap policies would add a significant burden to this vulnerable group, many of whom have been paying for Medigap coverage for many years and are often on tight budgets. Medigap issuers do not receive any additional state or federal funds to offset increased costs of covering an under 65 enrollee. The costs of the risk pool are paid solely by the patients in the form of premiums. If a risk pool's costs increase substantially, premiums for future years will increase to cover the additional spending. In order to preserve senior Nevadans' financial peace of mind, we would urge this committee to not process this bill. I will tell you that Senator Lang, of course, as always, is wonderful to work with. We have submitted language. We talked about, could there be one plan that offers this and some premium flexibility so we can keep the costs a little bit more contained so it doesn't affect everybody in that entire risk pool. But we will continue working with Senator Lang. Thank you, Madam Chair, for your time.
Good afternoon, Chair Marzola and committee. For the record, Shelley Capurro, representing the Nevada Association of Health Plans. And I did sign in opposition on this bill, and I'd like to explain why. First, we would like to thank Senator Lang. We have had conversations with her, but we are still in opposition. Our members are very concerned with the cost implications of SB 292, since the bill mandates that insurers offer all Medicaid supplemental plans to individuals under 65, including those with ESRD, and the plans must be offered at the same premium rate as those plans for individuals over 65. We would like to emphasize we are not requesting the removal of the option to enroll under 65 ESRD beneficiaries. We are aware that 36 states allow enrollment for under 65, and 21 of those 36 states have some requirement around premium rate methodology, and we're okay with some of that. But only 7 states mandate the same premium rate mandates that are in SB 292. Per data from the Kaiser Family Foundation, Nevada's average monthly premium rate is $221 monthly, and we are already above the national average of $217 a month. And Kansas was referred to previously. We are already above Kansas, and this bill is not even in place. Among the 7 states that were referenced, Nevada already ranks second highest, with New Jersey being the highest at 228. We conservatively estimate that this could be an increase to premiums of 5 to 10% with the mandates of this bill. This means that a $221 monthly premium now would be anywhere from $232 a month to $243 a month. And we know that increases, no matter how small, can be cost prohibitive to Nevadans. Therefore, we are asking for the flexibility that was mentioned in this hearing and by Mr. Abney, so that, again, we are in alignment with making Medicare supplemental plans accessible and affordable to Nevadans, but we're looking for flexibility to make these affordable. Thank you. And we do hope to continue talking to the senator on this. Thank you.
Thank you for your testimony. Is there anyone else in Carson City wishing to testify in opposition? I don't see anyone. I still don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
To testify in opposition to Senate Bill 292, please press star 9 to take your place in the queue.
Thank you all very much for this meeting today. My name is Jason Casey. I am an insurance broker in Sparks, Nevada. I do Medicare. That is my principal business. Have been doing it for 20 years. The reason I'm in opposition to this bill is because I have seen throughout the years the rising costs of Medicare supplements within our own area as well as in the Las Vegas area. The problem becomes adding on to things. Now, I'm not in opposition to under 65, giving them to under 65, but I think that we ought to do it to just certain plans or carve out these plans as other states do. I do like to point out that a state next to us has under 65 rates, but does not allow ESRD even on their 65 plans. Now in Nevada, 98% of all people on Medicare over and under 65 are eligible for Medicare Advantage plans. What about those 2%? Totally get it. And that's why I think we ought to reduce this to Plan A, which would take care of all of their options. And if we leave it open to all plans, believe me, people are going to just only choose one or two of those plans. So that is why I am in opposition without some amendments to this plan.
Chair, we have no more callers for opposition at this time.
Thank you. We will move to neutral testimony. Is there anyone in Carson City wishing to testify in neutral?
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Division of Insurance. We submitted written testimony. Just wanted to put on the record that we don't see any issues from a enforcement or any other standpoint for the division, so we're neutral. Happy to answer any questions.
I don't believe we have any questions, but thank you again for being with us. Is there anyone else wishing to testify in neutral? I don't see anyone walking up. I still don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
To testify in neutral to Senate Bill 292, please press star 9 to take your place in the queue. Chair, we have no callers for neutral.
Thank you. Senator Lang, would you like to give any final remarks?
Thank you, Madam Chair. Senator Lang for the record. Just to put it again in perspective, that for these patients, it's the difference between life and death. And if we can't get them the help they need through insurance, you can't fix the problem, right? And so we will continue to have conversations with insurance. In the research we've done, the premiums have not raised significantly. But we'll continue to have those conversations and we'll get back with you. But I encourage you to support this bill. Thank you.
And thank you again for being with us today. It was definitely your day. I will now close the hearing on Senate Bill 292. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes. Is there anyone here in Carson City?
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N. With your indulgence, I'm offering a mea culpa. I inadvertently misrepresented testimony on Senate Bill 246. 45 CFR Section 149.310A3 relates to the specific provision that access to an obstetrician or gynecologist must be done without a prior approval. Sub A1 relates to designation of a primary care physician. I said that the ACA requires insurers to allow a OBGYN to be designated as a primary care physician. That is incorrect. The ACA requires people to designate a primary care physician, and if their state defines a OBGYN as a PCP, then they are brought in. And because Nevada does not currently define an OBGYN as a primary care physician, that provision would not apply in Nevada currently. And carriers may permit an OBGYN to be designated as a PCP, but are not required to do so. I apologize for that inaccurate statement. Thank you.
No, thank you for that clarification. We appreciate it. Is there anyone else in Carson City wishing to give public comment? Don't see anyone walking up. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
Thank you, Chair. Our public lines are open and working. However, there are no callers choosing to provide public comment at this time.
Thank you. Are there any comments from members before I adjourn? I don't see any. This will conclude our meeting for today. Our next meeting will be on Friday, April 25th at 12 p.m. This meeting's adjourned.